Hello, thank you for coming. So, one of the reasons I got into documentaries, besides the wonderful life of travel and the money, no, there's no money. You get to meet incredibly interesting people that I was an actor for years, and I met many actors. I met many television writer, directors, filmmakers, who are great. But once I started making documentaries, I realized there was a whole other world out there, and hopefully it will affect change. Not always, but that's a great plus, especially if you can make the documentary entertaining, exciting, and it has a real point of view. I got to work with the United Nations and follow peacekeepers who are trying to make a difference, and work with oceanographers and people trying to save the planet. So when I was asked to participate in this panel, I was very excited because here are people who are really making a difference. And you are also people who can make a difference, hopefully, by teaming up with one of these people or an idea. I find that exciting. What's difficult is often science and facts, and a lot of what you learn is very hard to watch or to take, as you know, we all know. So how do you tell a story and make it exciting and make it effective and be able to affect change? So I think that's what we're here for, and hopefully there's 3 stories here that one of you will be inspired, or 3 of you will be inspired to do something with, and I'm curious to hear their pitches and hear what they do, and I'm about to start. I'm going to open it up, and I'm going to start by calling out Donna Butts, who is going to be our first pitch. Donna?
Good afternoon. While traveling last year in Bhutan, a country that measures gross national happiness and requires tourists to pay a set minimum amount to visit, I fell in love with the natural beauty, the close family bonds, and wonderful, warm people. One day, our excellent guide smiled and looked at us and said, "You know, my little brother." He looked at me one day and he said, "Pema, are there any children that live outside of Bhutan?" The tourists, his only contact with the outside world, were all older and had money and time to travel. So think about it. Are there any children that live outside of Bhutan? We face the same danger of isolation in the US, where we've sequestered people by age, not by family or relationship or interdependence. We've created older adult communities where it could be easy to say, do children still exist? We've built schools, teen centers, and sports venues where seldom a gray hair appears. No wonder the little boy said to an older, wrinkled volunteer in his classroom, "You know you could iron your face." We've established policies, programs, and services by age. 50 and fabulous communities where the conversations trend towards pain, pills, and passing. What hurts, what medication you're on, and who died. At the same time, we've created gathering spots for the young where the conversations focus on newer versions of Twitter, Twilight, and texting. We need to merge the P's and the T's. We need to wake up and smell the demographics. While only 22% of people over the age of 65 are of color, more than 50% of children under the age of 5 are of color. We're building an age-segregated society that's on a trajectory to become racially and ethnically segregated as well. And if those are not our children or our grandchildren or our grandparents, why should we care about investments in those populations? Beyond demographics, it just makes sense. We're all getting older, and before you know it, the older generation will be us. Some of us are already there. How do we want to get old? Do we want to be isolated from other generations? We all need each other, especially when we're young and as we age. We humans all need purpose, a reason to get out of bed in the morning. Older adults that have checked in instead of checking out report that they feel more optimistic, they have greater social networks, they take better care of themselves, rely on canes less often, and they burn 20% more calories. Young people also benefit from other caring adults in their lives. They learn the value of volunteering and adding to community life. They report less fear about their own aging and view people of all ages and abilities as their friends. Our communities benefit when they are viewed as good places to grow up and grow old. Intergenerational practices involve all generations, but most importantly, they involve our bookends, our younger and our older, that hold civil society together. It's imperative for people to adopt an intergenerational lens, one that values and engages people of all ages, if we're going to shift the conversation from burden to benefit, from competition to cooperation. Intergenerational approaches save dollars while making sense. Think about economies of scope where you take a single action that touches a lot of lives and generations. For example, Kari is a teenager who found a 90-year-old mentor and powerful role model in Mr. Bowman when he pursued a project to record the history of the oldest African-American cemetery in Washington, D.C. He organized intergenerational teams to preserve history that would otherwise have been lost, and he brought a huge sense of relief to his older colleague who worried his life work would be in vain. Now Mr. Bowman says with a smile, "I know my work will go on." And Kari says he's learned to harness his own perseverance and has a model of personal strength to look up to. Grandma Kelly is 92. She has 9 grandchildren, 20-some great-grandchildren, 1 great-great-grandson, and 118 foster grandchildren. Since 2003, she's lived at San Pasqual Academy, a residence and high school for in San Diego County for foster teens. Unlike many other adults who live there on the campus for reduced rent and the task of caring about the kids, she never graduated from high school. So Grandma Kelly doesn't feel she can tutor academically, but she believes she's there for life's lessons: cooking, gardening, self-respect. She encourages them to ignore the foster label and speak their names louder. "I want them to say their names as importantly as they are," she said. "I didn't realize I could fall in love with so many kids." Annette and her husband found themselves parenting once again when their daughter became ill and couldn't care for her young sons. Overnight, they became a grand family. Nearly 7 million children in the US live in households that are headed by a grandparent or another relative. While the policies that support or inhibit the families vary from state to state, the hard work and feelings of isolation are universal. Along with hundreds of other grand families from around the country, Annette celebrated and advocated at the National Grand Rally in Washington, D.C. She says no one knows how hard it is or how rewarding it is, and we wouldn't have it any other way. Connecting and caring across generations are fundamental parts of our society. As human beings, we're interdependent, and we're stronger because of it. Let's move from silos to solidarity, and remember, it's not a fight, it's a family. Thank you.
Thank you. Okay, you should stand up there, yeah. So, and is somebody gonna time when it's time to move on? Okay, thanks, Milton. So, Donna, I'm a little confused as to your day-to-day. What is your day-to-day in terms of, is it to raise consciousness about this issue, basically?
That's a lot of what Generations United is about,
right.
Is raising consciousness about the fact that we are stronger together and not pit the generations against each other. We were founded when there was a journal that had a cover photograph of an older person and a younger person. They're in battle fatigues, they each had a gun, they were back to back, and basically the message was march 10 paces, turn and shoot. Whoever's left deserves the resources that our country has to support our vulnerable populations. So our founders said no. We're stronger, and we are a country that can support our oldest and our youngest.
So, in your mind, if somebody gave you, and say you got Davis Guggenheim or a great documentarian to make a movie about this, can you just briefly say what in your mind that would look like? Would it be about Kelly? What in your mind? How can we push this forward filmically?
I think that any of the 3 examples that I gave are really wonderful visual examples. Grandma Kelly, if you saw the picture, is about this tall, and she hangs out with these foster kids who are huge, who adore her. And one of the foster mothers there actually has a young person that his duty every afternoon after school is to go to her house and pick the avocados because he can reach them. So there's that sort of visual aspect that shows that we are interdependent, that we need each other, and that that's okay, because we're pushing against the societal norm in our country, which says you have to be independent. But in fact, we do need each other. So there's that visual of people connecting. It's not instant, it's not magic. I always say you can't put two generations in a blender and hit mix. There's work, but it's worth it.
Okay, are there any questions out there? Yes. There's a microphone, I think.
Hi. Just a question for you, because I'm a filmmaker and a producer, and when I hear you speaking, you're speaking about moments or little snapshots that sound slightly infomercially. But when you go to show a film, you're following a beginning, middle, and end, the depth to a story. So if you're pitching something to try and hook somebody, what about her life? What does she struggle? What is the day in, day out? How does she connect? Who are some of the people she connects with? What are her challenges and what are their challenges? And how do these two worlds hit or mesh? And then what are we going to see? Because anyone in here is going to want to buy into your idea, but want to know what they're going to get. What is the depth of the story? So what would be great is to hear more about the specifics of their lives and their characters that lure us in to make us want to see a film about it. So I was a little confused too. I wasn't sure if it was about Bhutan or because you're naming many things, but just one specific story with this depth, I think could really, we would be more engaged.
So one specific story. I think a really good example of that is we actually did have the opportunity to work with a documentary film about 10 years ago that was nominated for Academy Award called Legacy, done by a wonderful person named Todd Lending. And it was about a family that they followed the family with their struggles to get out of the housing projects in Chicago. And it shows a really strong central grandmother figure and the struggles, the real life struggles, it's not all roses, that the family went through. And then fortunately, there is an ending where they get out of that house. And our role was to look at it and educate policymakers about it. And because of Legacy, we were able to introduce legislation called the Legacy Intergenerational Housing Act that was passed and now provides housing for grandparents raising grandchildren. So I think in that film, to me, it was a good example of the depth that you're talking about, and then what partnering with a group that can advocate and help give voice to your ideas is also about. Grandma Kelly. Grandma Kelly has a wonderful, rich life of somebody who didn't go to school, but who raised children, who's now a grandmother. And when she got to her older days, she was looking around and wondering what she could do and how she could still be engaged, because she felt that she was really isolated. So when she found San Pasquale Academy and went there, she found these connections with kids who just needed an older adult to care about them, to be there for them. And she figured she could do that, along with her neighbor that makes a pillow for every young person that comes to that academy. And several years ago, there were fires in San Diego County, and all of the houses around San Pasquale Academy, where the older adults live, burnt down. So the older adults were displaced. The young people were displaced. But as soon as they could, they brought trailers back to surround the kids again. And the grandparents were so anxious. They had lost everything, but they had to get back to those kids. And those kids needed to reconnect with those older adults. And I was fortunate to be there the night that they first came back. And there wasn't a dry eye in the house, because they need each other, and they feel like they have a purpose to keep going. Grandma Kelly probably wouldn't be alive at 92 if it wasn't for those children.
We're gonna have to move on. This is unorthodox, but there was the cover story of the New York Times 3 or 4 days ago about that woman in Delaware who was 86 years old, who was sitting in front of an ice cream shop deciding whether to have butter pecan ice cream, and these 14 and 15-year-old girls asked her for a ride. She gave them a ride, and they locked her in her trunk and left her there. I don't know if you read that. You should look at that article. And we read that, my girlfriend and I were like, that would make a great movie. And that really was a generational, they left her in a cemetery alive, and in the middle of winter. It was just unbelievable.
Yeah, and too often the stories are on that instead of the young man who was helping the older man capture the stories about the graveyard. Because I think those are things that are happening more often, but we focus our attention
on the bad
the tragic
as opposed to, right,
and the sensational.
That's very true. Thank you. Thank you so much, Donna. Thank you. Thank you. Okay, our next speaker is Eric Sawyer, who's one of the founder or co-founder of ACT UP, among many, many other things. You can read all about him in your program. Eric Sawyer.
Hi, thank you very much, Fisher. I'm going to talk about AIDS in 30 years in the epidemic. Is the crisis under control? And I'm here to say it's not, and it's largely because of HIV-related stigma, discrimination, and criminalization of both HIV exposure and of at-risk behavior of people living with HIV. This shows just how out of control the epidemic is. 34 million people currently living with HIV, around 30 million deaths, 2.5 million new infections every year. That's 7,000 a day, 1.7 million deaths every year. That's around 4,600 deaths a year. This shows how HIV is spread around the world. It's crossed all borders, largely focused in sub-Saharan Africa, a heterosexual epidemic, 23 million. There's 4 million in India. It's also heterosexual drug use, and MSM behavior is what's driving it in Europe and in North America. This slide shows that around 97% of HIV infections are in low and middle income countries, around 1,000 people under the age of 15 every year infected with HIV. It's about 50% women and 40% youth. This shows how much HIV is out of control. You think it's under control in the US, only 80% of people know they're infected. Only 2/3 have been linked to care. Only about 1/3 have been prescribed HIV medications, and less than 25% have their virus under control and undetectable. Why is this happening? It's largely because of stigma, discrimination. It's partially because of the early people impacted by the epidemic. It was mainly junkies, queers, and whores, the untouchable people. And because of the horrible disfiguring illnesses like wasting syndrome and Kaposi sarcoma that affected people with AIDS. It made people develop this fear and think, oh, it's witchcraft. What's driving it? It made people think that people with HIV were their disease, that they were lepers, that they were untouchable, that you couldn't be around them, or you'd end up looking like this man here, suffering from wasting syndrome. But that fear doesn't need to exist, because that is the same man a few months later after getting on antiretroviral drugs. The drugs cause a Lazarus-type effect. People rebound to health. They can be healthy again. And this is actually an image from ACT UP, a group I helped start. Keith Haring did it. It was all about how ignorance and fear are fueling the epidemic, and how we can't be silenced about the epidemic, because the silence is just perpetuating this fear, the stigma, the discrimination, and death. UNAIDS is so upset about the fear and stigma. It's one of the 3 main priorities for UNAIDS. One is eliminating new infections by prevention. The second is reducing AIDS deaths through treatment, but the third is discrimination, promoting human rights, and not only does UNAIDS feel that strongly about stigma and discrimination, but the UN in general started a campaign to create a stigma-free UN environment, one where stigma doesn't fuel the epidemic, because stigma is more deadly than the AIDS virus, because it spreads the infections of HIV. HIV criminalization is also a big issue. There are more than 34 states in the US where there are specific laws that address HIV infection. If you are a person who's positive, if you have protected sex, you have an undetectable viral load, but if you don't tell the person you have sex with that you're HIV infected ahead of time, you can go to jail for 25 years. Even if you don't infect the person, if you don't expose them, just if you didn't tell them you were positive ahead of time. This fear is driving, HIV detention centers. It's allowing people to be locked up, like I mentioned, for 25 years. It's making people who have sex and don't disclose their status end up on sex offender registries. That young man had a partner who was negative, After he broke up with that negative individual, the guy went to the police and said, "Oh, I lived with this guy. He never told me he had HIV, even though he had and was on meds. The guy knew it." But he ended up in jail for more than a year and now has to register as a sex offender for the rest of his life. That's not fair. That's inhumane. And those laws that criminalize HIV behavior, they also include laws that criminalize same-sex relations in more than 40 countries around the world, some of which have a death penalty if you're gay or lesbians, laws that criminalize drug use, drug possession, needle possession. There are practices in the US where if a woman is walking, or a transgender person is walking in a neighborhood where a lot of prostitutes frequent, if she has 3 condoms in her purse, that can be used as evidence that she's a prostitute trying to procure sex. Those types of laws and judicial systems have to end because it drives sex workers, drug users, gay men underground. They don't come forward for information, testing, or treatments that can allow them to live long, successful lives and be non-infectious. Treatment reduces the infectivity of HIV-positive people by 97%. I myself have been living with symptoms of HIV since 1981, when the illness was still called GRID, when they didn't know what caused it or how to treat it, and the horrible illness, the horrible way people died, and the fact that you didn't know how it was treated, you didn't know what was causing it, you didn't believe the horrible deaths that people were facing, started this fear, this stigma, this discrimination. It's got to end if we want to get the HIV epidemic under control. And you need to help us get that message out to the public, or we'll never get this epidemic under control. Thank you.
Great. You could stay up there. Thank you, Eric. So, Eric, the second, I guess the last part of your speech to me was information that I didn't know. The first part of the speech is information I've heard many times. It's been battered into many of our heads. It's all important, by the way. I'm not taking away. I'm just looking at it from a filmmaking perspective. The last stuff, that to me was very shocking and cinematic. And especially, again, what this woman was saying, when you personalized it with that photograph of the before and after and the license plate with the man saying sex offender, that immediately brings incredible imagery and storytelling. I'm going to ask all of you the same question. What, in your mind, if some great filmmaker came to you and said, "I want to make a film," and how can you make what would be your main thrust then?
I think the thrust would be to look at why is this disease being treated so differently than so many other diseases. No one would think of locking somebody up for 25 years if they had TB and didn't tell somebody if they were in the same room with them, and that's actually a more infectious risk scenario than having sex with someone using a condom when you have an undetectable viral load. You wouldn't think about this type of criminalization, and literally there's forced quarantine happening for any other illness. 2 examples. In Kansas right now, the state legislature is considering a law that will force anybody to have to take an HIV test if they spit in the face of, or if they throw up on the shoes of a cop or an EMT individual. And if that person is HIV positive, they then can be charged for such crimes as assault with a deadly weapon or aggravated assault, and can relate to, can end up with long prison sentences. There was one case that we fought this year in New York, which does not have specific HIV criminalization laws, but a guy named David Plunkett was arrested in Herkimer, New York, a number of years ago. A cop literally beat him unconscious He was arrested because he was disorderly. He had some mental health issues in a doctor's office. The cop cut his hand, knocking the guy out, punching him in the mouth, found out he was HIV positive, brought the guy up on charges of assault with a deadly weapon. He was sentenced to 10 years in jail for using his saliva to try to infect that cop with HIV. The appeals court threw that out, but the DA tried to bring him up on other aggravated assault charges to keep him in jail because he was a dangerous AIDS predator. That type of behavior has to stop. There's a famous case in New York about a guy named Nusan Williams. He was a young black college student in upstate New York who had sex with a number of primarily white teenage girls in upstate New York. Some of them he infected. It's unclear whether or not he knew or understood his HIV infection, but he was sentenced to 13 years in jail for those activities, even though there's no criminalization law in New York. His prison term expired 3 years ago. He's been detained beyond the length of his service out of fear that he's a public health risk, but because he didn't show enough remorse about infecting those people. There's a trial in July of this year where he is going to stand for permanent internment, permanent incarceration as a public health threat because he's not showing enough remorse about infecting these young people to protect the health. Can we really allow those types of forced quarantine for treatable illnesses to go on in our state? I hope not.
Okay, let's open it up. Any questions? Yes?
Hi. I was at the screening last night and was there when you spoke so eloquently about your reaction to the film Blood Brother. My suggestion is that in that particular case, you were incredibly emotional and passionate and very focused, and you really pled a case for bringing greater visibility to the group of children that were suffering from AIDS in that particular film. So I was thinking if you could figure out how to find an example that moved you as much as that particular film did and those people in that film did, and present in that same very succinct, I don't think you were there for more than a minute, okay? But
right.
Everybody in that audience, you had everyone. So may I suggest that you find a particular scenario like the one that you reacted to last night and, you know, fill it with the passion.
So
and
none of
emotion
those he just said got to you.
You just need to put a face on it.
Right.
Okay? And a face that moves you the way you were moved last night.
Right.
I'm just saying.
Let me give you another example. There's a young woman who was in the military, daughter of a minister. She's from the South. She was infected by her unfaithful husband. She divorced, but continued to be in the military, was very nervous about dating, started dating somebody else in the military, did not disclose her HIV status because they ended up in a sexual situation after a couple of dates. But she insisted that the guy use a condom, even though he didn't want to. The condom broke. She said to him, "Oh my God, you know, I didn't tell you this ahead of time. I wish I had. I'm HIV positive. I have an undetectable viral load. The chances of you getting infected are almost zero, but we can improve that by having you go on post-exposure prophylaxis. Go to the clinic, say you had sex with somebody who was positive. They'll give you 1 month's ARVs, and that'll pretty much guarantee you won't get infected." The gentleman knew enough about HIV that he wasn't that concerned, but he took her advice. Being in the military, he also went to the military medical facility. The people in the military medical facility turned her in. They gave him the post-prophylactic exposure, but they turned her in and they court-martialed her. She was thrown out of the military with a dishonorable discharge, lost all of her veteran benefits for the rest of her life. And now she's started a support group for women. But they then also turned her into the local authorities and were working with the DA to get her thrown in jail for what she did. Her partner, who ended up marrying her, refused to press charges, so she wasn't brought on to charges. But that's the lunacy. And that woman, a lot of her life has been destroyed. No veterans benefits. She was hoping to go to college on the GA bill. All of that has been wiped away simply because she has a virus.
Okay, we have to wrap it up. I'm sorry, but Eric will be around afterwards. Thank you very much, Eric. Okay, our final speaker will be Alexandre Kalach, here all the way from Rio de Janeiro. Alexandre.
Thank you, and very good afternoon. The story that I'm going to talk is, to a large extent, is the story of my life. It is to do with aging, and it is to do with age-friendly cities. I was born here in Copacabana, and if you have never been there, I strongly advise you to. It's a great place. And you may think that Copacabana is a place full of children, young people, adolescents, beautiful women in bikinis, and strong men playing volleyball. It is that, but it is above all a place where you have older people. I was born right here behind this building in a maternity that I tell you, today it is still a hospital, but it is a geriatric hospital. In my lifetime, from a maternity to a geriatric hospital, which means that if now that I live in there, I have a great chance to end up where I first started. And this is the story of Copacabana that is just giving a taste of what is happening throughout the world. When I was born, life expectancy was 43. In my lifetime, we have added to Brazilians 32 years of life. And it's not 32 years of old age, it's 32 years of life that we have to capture this tremendous energy to make it a very positive, what is indeed a very positive achievement, an opportunity for people to grow older, active. And going back to Copacabana, in 2005, there was a gerontological international conference. They invited me to speak at the beginning of this conference. I was at the time working for WHO. And I thought, well, what I'm going to do is to bring together these two words that for an international audience don't go together that well, aging and Copacabana. And what I did was very simple, was to bring a group of older people to talk about the experience of what it is to grow older in Copacabana. A Copacabana that is very different from the Copacabana of my childhood and my youth. It's not this that you see anymore. Instead of mothers and young people with babies and push chairs, you have more and more older people, to the point that Copacabana now has a proportion of older people in the population as high as Japan, the oldest country in the world. And this is a taste of what is happening throughout the world, including developing countries. So these would be the people that have informed us what is to age in Copacabana. And if you look at what is happening throughout the world, we know that the total population is going to increase from 6 billion to 9 billion. This is the population altogether, 3 extra billion people to feed, to create jobs, to nourish, and so on. But we are talking about an increase of 50%. The real shift that is going to take place in demographic terms is here, the population 60 plus, that will increase from 10%, 600 million in 2000, to 2 billion in the year 2050, 22% of the population. We have today more older people, aged 65 and over, than all older people combined throughout the history of mankind. We have more 65 and over today than all the 65 and over that have ever existed. It's a real revolution, and we have to pay attention. But in parallel to aging, we have another demographic phenomenon that is also impacting the world altogether, and this is urbanization. I don't need to talk about urbanization, the most urbanized city in the world, New York. But more and more, we are going to see lights throughout the world. It's not only Europe and North America. It will be increasing in South America, in Africa, in Asia, that you'll see more lights, because today we have more people living in urban areas than in rural areas for the first time ever. And in another 15 years, this will increase to 2/3 of the total global population. What we did in Copacabana was an inspiration for us to tidy up the methodology, to do it in a more systematic way, and we repeated that experience of listening to the voices of older people in 35 cities to create these age-friendly collaborating cities for WHO, so that we could launch in 2007 the Global Age-Friendly Cities, a guide. This guide has now been used by over 1,200 cities. It has become a global phenomenon, north and south, east and west, and it is inspiring policymakers as well as older people throughout the world, so that we can see what it is that is needed in order to improve the quality of life for us. Because if it is going to be age-friendly, it's going to be friendly to everybody. It's not only senior-friendly, it is friendly to age. So what is an age-friendly society? Well, ask them, ask older people. Do focus groups, do public forum. Preferably bring together young people, older people, so that there will be a real dialogue. And this is what we have been doing in these 1,200 cities. So it's a bottom-up process. And they will tell you very surprising things, like in Copacabana again, where people live, like here in Manhattan, in apartments, people on top of each other, but down there at the concierge, there is a porter, a doorman, a porter like this doorman that is there looking after, providing services, being available. It's not only to carry shopping, it is really to be a community agent that can really improve. I remember in one of the focus groups, this old lady saying, I pray every night for my porter, my portero, not to die before me. Because if he dies and he's getting old, you know, I will be completely lost. So you can see the importance of this guy that is there providing not only the physical service and support, but social and so on. But we also need a top-down. We need the response, like here in Australia, guidelines that have been prepared by the government for the community leaders, for the health services, for the social services, and so on. Or in São Paulo, where we have a very strong program to retrain, to bring people like this old pianist who had an accident and could no longer play, and now he has retrained himself, has become a maestro, and he is now training young people from the favelas, from the periphery, so that they can become talents using his experience and knowledge. So an age-friendly society in Australia may be very different from what an age-friendly society is going to be in Rio. But I can only remind you that the girl from Ipanema is now 75, and she is looking after her mother with Alzheimer. This is the reality that we have today, or the reality of someone like Pelé, the most iconic Brazilian ever, who is turning 73, and we hope to use Pelé to make the first Olympic Games that will take place in Rio, in Copacabana, in 3 years from now, and to have him as a champion, an ambassador for active aging. Thank you.
Thank you, Alexandre. You can stay up now. So the question I asked the others, what, in your mind, if a filmmaker said, I'm going to make a film, and how would you encapsulate a film about what you just, in your mind?
In my mind, what would be really very graphic and provide very good pictures is really to listen to these voices of older people and see what you can enact in terms of policies or interventions based on them. So it's the voices coming from the ground that are so silent because societies are not used to pay much attention to older people.
Okay, good. So those guidebooks, inside those guidebooks can you give a couple examples of what would be it? I want to open it up quick, so just quickly.
Well, you have examples like, the porters. We have examples like, again, in Copacabana. They said our best friends are the porters. Our worst enemies are the bus drivers. So we have to train these bus drivers. We have an intervention that is based on what they are saying that could improve the quality of their lives. We have to unleash this energy. The fact is that if we are going to have, by 2050, 1/4 of the total population, older people, we need their contributions active in our societies, be developed or developing countries.
Okay, any questions? Yes, in the back.
Can you tell us about the girl from Ipanema?
Sorry, can I sing The Girl from Ipanema?
No. Can you tell us about her?
Can you tell us a little bit about her life since she first burst on the scene and how she came to be where she is now? And is that a potential story?
The song was composed in the early 60s, in 1961. And Tom Jobim and Vinícius de Moraes, the composers, they were just having a drink, a beer, in a bar in Ipanema. And they saw this wonderful girl just floating on the way to the beach. So that is how they composed. But she has become a celebrity of some kind. She has become an anchor for television chat shows. And she has aged very gracefully. She continues to be very active. She continues to be a public figure. But I think it is so powerful to see that the girl from Ipanema is now 75. And it is the actual aging of a girl that had become iconic for her generation. But it is still there, alive and contributing. But we can sing the girl from Ipanema.
Garota. Okay, anybody else? We know your film would have amazing music. Yes. Why
The bus drivers are the enemy because they don't stop, they don't pick up the older people because older people don't pay, it is a law. So there is no incentive from the owners of the bus companies. They're not the villains, they're not heroes either, they're just agents. And it is a systemic problem that ends up in their hands. So they don't want to pick them up because if you have more than 10% of people that don't pay, you are going to be punished by the supervisor. Again, because you have to do 16 loops in 8 hours in a crazy traffic. And if you pick too many older people, they take longer, you know. And therefore, you don't want to wait, and you will start abruptly. That older person will have a fall. It is a hip fracture. It's the beginning of the end.